Hey guys, what's going on? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. Visit my website at HAIRLICIOUSLY.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, serum, hair growth vitamins, and a few other products to help those who are losing hair. So in today's video, I wanted to talk about a rather interesting post that I read on the forum Hair Loss Talk. And it's regarding a guy's personal experience using oral finasteride and how he basically stated that it destroyed his life and his hair. And you'll see this trending from various hair loss forums where quite a few people associate and they also blame further progression of their hair loss as a result of either finasteride or dutasteride use, which is obviously contradictory. And at least in my personal opinion, unless you're experiencing, certain types of already known side effects in a small minority of people who are taking 5-AR inhibitors, typically sexual dysfunction, low libido, you can't really contribute finasteride or dutasteride causing further havoc to your hair follicles because they're supposed to help in reversing miniaturization by lowering DHT levels. And if you still, for some reason, paradoxically continue to lose hair despite being on 5-AR inhibitors, you can't really blame the medication itself. It's ultimately going to be based on your genes and possibly your sensitivity to androgens. And if something like 5-AR inhibitors in itself aren't doing much, you probably need to venture into other treatments like anti-androgens and other growth stimulants and therapy. But let me share and analyze what he said in his post and give you guys my 2 cents on his claim. So here's what he wrote in his post back in April 2022. He says, "I'm not saying that finasteride is bad for everybody, but in my own anecdotal experience, finasteride has literally destroyed my hair and my confidence. If you're planning to take it, then know that there is a chance this might happen to you as well." So I started taking finasteride 1 milligram every other day since May 2021. He's 25 years old. And my hairline has progressively gone worse, especially on my right temple. I'm not sure why hair loss doesn't progress equally throughout the hairline, but it is what it is. And by the way, I'm not stretching my hair with any hairstyle or anything that might pull out my hair. First off, good job to this guy for starting finasteride. A lot of people are afraid to take finasteride due to fear mongers online that create this image that finasteride is inherently bad or harmful, but it's one of the best FDA-approved hair loss medications out there in my opinion, and with multiple studies to back up its efficacy, it works pretty well in slowing down further hair loss in the majority of users. He started off the bat by taking 1 milligram every other day. For anyone starting off finasteride, I would personally recommend starting either 0.5 or 1 milligram every day as opposed to taking it every other day, only because you see the best results from daily oral intake. And it also takes time initially for finasteride to, gradually accumulate in the system since it does have a relatively short half-life. This also means that it's possible that you might be fluctuating your hormonal profile to a degree if you guys are not taking it daily, which can potentially, cause side effects for certain individuals who are sensitive to hormonal changes. And if that's also the case, I would highly suggest that you get some blood work done prior to jumping on finasteride, just so that you have a baseline in the unlikely event that you do experience adverse side effects. Unfortunately, there aren't any studies that study DHT inhibition from taking finasteride at various frequencies throughout the week, but just personally speaking, I would recommend once every day, just like most studies reference, given its short half-life. And, with that said, there are some people that are okay and seem to have decent results taking it every other day, while others start noticing side effects from taking it on a less frequent basis. So it really depends on your body and each person. And as far as I'm stating that hair loss doesn't progress equally on the temples or hairline, this is actually absolutely true. Even in my case, even before my hair transplant, I think it was my right temple that was more receded than the left, and it's just the nature of androgen alopecia. Hair loss is asymmetrical for everyone, and I have yet to see anyone who's had a symmetrical type of hair loss pattern. Moving on, he says, "Anyway, I know it works because my hair fall has actually decreased when I wash my hair or comb my hair with my fingers. For the first 2 months, nothing really happened, and I was pretty happy seeing that I had less hair fall. By the way, I never encountered any sexual side effects from finasteride, but 2 months later, I started to see some increased recession on my hairline. It was getting visibly thinner, and the bald spot is growing at a pretty fast rate. But the interesting thing is that there is no shedding. just increase miniaturization and recession. So I'm kind of confused on what this guy is stating. If you are on finasteride initially, it's going to rapidly increase the number of anagen phase hairs, and these affected hairs are driven to a cycle in a synchronous manner. And then after a similar anagen phase, these hairs would then enter the telogen phase, followed by a temporary subsequent shedding, which to some people may or may not be noticeable. And this is typically done in a partially synchronized fashion. And this is why there are people who are on finasteride that experience temporary shedding about 2 to 4 months into their treatment. And not all hairs are going to be shedding at the same time. You know, these hair follicles are in different hair cycles when you begin finasteride and even prior to finasteride. So this means that you may see some shedding in some areas while other areas may not see the shedding because they might still be in the anagen phase. And this likely explains how some areas appear to be thinning in this guy's case. Now, it is also possible that he has a case where finasteride in itself may not be enough to slow down his hair loss, since there are still, circulating androgens that are not being accounted for, and he may have to resort to something more potent like dutasteride in conjunction with an anti-androgen. And from studies, we know that finasteride only inhibits about 40% scalp DHT levels. So if you have a higher sensitivity to androgens, you may need to resort to something, more stronger. But I feel like at just 2 months in, since his start of finasteride, it really sounds like the onset of some shedding going on. And when he also says that he didn't see any shedding and only experienced miniaturization and just recession, I feel like that really isn't possible, because the way that hairs miniaturize is that they get thinner and thinner after just multiple hair cycles, meaning they have to go through the anagen, the catagen, the telogen phase, and then eventually shed and go through the cycle several times, with each subsequent hair follicles becoming more and more miniaturized with shorter anagen, longer telogen cycles. Existing hair simply doesn't miniaturize and get thinner without having gone through the shedding phase. So I'm pretty sure, at least at this point, what this guy is experiencing is shedding that has occurred due to finasteride use. He also shared some photos, and this was taken May 2021 when he just started taking finasteride. Not the greatest photo, especially with the hairline being covered up and just being down. But, he seems to have a decent hairline, and that one area above his right temple that looks to be slightly thinning appears to be his area of concern. And it's kind of difficult to tell from the angle and lighting, but June of 2021, we can see a better photo of the thinning area on his right temple. And then moving on over to August, it still doesn't look bad. He has an intact hairline, but there are some miniaturization going on in the hairline and the temple area, but it's nothing alarming at this point and can potentially be attributed to shedding going on from finasteride. And then he says, fast forward to September, November, and my balding spot on my right temple has grown to about 3 by 4 centimeters. I started to panic, and my self-confidence was really hitting rock bottom. By the way, at this point, I was already on Minoxidil for 1 year plus. Didn't seem to do much after a few months. So here you can see both September and November photos of his hair. It does look like the temple has become a little bit more thinner and miniaturized. I will add that different lighting environments can also create 2 totally different degrees of hair loss. And comparing both photos, the lighting is clearly not the same. But I do agree that the right temple has progressively miniaturized despite at a slower rate. And just kind of going back earlier to what I was saying, finasteride is not going to respond for everyone. For some people, it might stabilize their hair loss. For others, it may stabilize and give you some extra growth. Now, most studies that we see on a finasteride look into baseline to 24 weeks or 48 weeks. So I would highly recommend at least sticking with finasteride and being consistent with treatment for at least 6 to 9 months minimum, preferably at least 1 year, before making a decision on whether it's working or not for you. Given that this guy did start finasteride in May of 2021 and is already claiming that it just may not work after just 5 months of treatment, it's kind of a bit premature and may need to stick with it a little bit longer to see if he is responding, better as the months progress by. And then he states, I started to Google and search for answers, and someone suggested that it could be that I was having a bad batch of finasteride, because literally I could not find any research article that says that finasteride would cause hair to recede faster. Also, I ruled out the classical case of reflex hyperandrogenicity, since I wasn't experiencing any shedding, increased acne, or scalp burning sensation. So same thing here. Finasteride is not going to cause hair loss, and you're not going to find any studies that show finasteride doing this, because it doesn't. If anything, finasteride is going to slow down further progression of his hair loss, as it inhibits the conversion of testosterone into DHT. And as we know, DHT plays a pretty significant and crucial role in androgen alopecia. And no, I don't honestly think that it's due to a bad batch of finasteride medication. He's been taking, doctor prescribed finasteride, and not through some random offshore online pharmaceutical company that, obviously always comes with the risk of being counterfeit. Whether he's using brand name Propecia or a generic brand of finasteride, they are all going to have the same active ingredient. And I've actually seen some posts regarding how generics aren't as efficacious as brand name, medication. Personally, I just find that to be stupid. There are bioequivalent studies on finasteride that show that generic version of finasteride tablets are still well within the predefined ranges and therefore are bioequivalent in terms of rate and extent of absorption. So I highly doubt that this guy received a bad batch of finasteride. Now, with that said, he also mentioned something known as reflex hyperandrogenicity, and its claim is that for whatever unfortunate reason, the decrease in DHE levels from finasteride causes an increase in androgen receptors in the scalp and in the body, which causes further hair loss. And this is kind of like the body's way of hypercompensating in response to the deprivation of androgens, and therefore this is literally the complete polar opposite of what finasteride is actually intended to do. Now, there are certain drugs that we know that can definitely upregulate receptors in the body, but when it comes to finasteride and particularly the androgen receptors on the scalp, it's honestly like a gray area, only because there are no documented evidence or any scientific studies or any clinical studies that finasteride can actually induce this condition to such an extent that it will cause further hair loss. There's also conflicting research that also shows both upregulation and downregulation in the androgen receptors found in the prostate of those who are taking higher dosages of finasteride, typically around 5 milligrams. But there aren't any studies showcasing this for the scalp and for much lower dosages ranging from as little as, like 0.2 to 1 milligram, which most people are taking for treating hair loss. And in addition, some of the studies that do show upregulation of androgen receptors were oftentimes seen on cancerous prostate tissue or those with benign prostatic hyperplasia, which also is not the same as scalp tissue. Now, out of the studies that I was able to find correlating androgen receptors and finasteride, the one with the best detailed study methodology using immunohistochemistry and morphometric analysis showed that androgen receptor epithelial cells in the non-cancerous prostate were significantly lower in patients treated with finasteride than control patients. So taking reflex hyperandrogenicity as a whole, there isn't any evidence backing up the fact that this phenomenon actually induces further hair loss through the activation of increased androgen receptors for finasteride use. Now, I'm not dismissing the fact that reflex hyperandrogenicity is real, only because we don't have evidence available at this current moment. But from what I've seen of just being active in the hair loss community is that all of these anecdotes about how finasteride or dutasteride destroys hairlines can actually be chalked up to people who either didn't respond or didn't take medication consistently or properly, or were simply witnessing the normal progression of hair loss in the months before the medication actually took place. At this point, I was using the Sturcia brand, which I found wasn't a very well-known brand, so I switched to the brand name Propecia during December 2021, and after 2 weeks, my hairline started to thicken. This was the first time that I actually seen some improvement in my hairline, in my hair loss, and I was like, this is it. The reason finasteride is killing my hair was because I received a bad batch of finasteride. By the way, I also added some other stuff like Nutrafol and Revita shampoo. But freaking hell, after around 2 to 3 months of decent run, my hairline started to recede again. And the worst thing is that I didn't change any of my regimen recently. In fact, I was still on the same batch of finasteride that I got from my doctor on December. So here's a photo of his hair loss from December 2021 and January 2022. The January year was a typo on his part and it should have been 2022. But anyway, we can still see the miniaturized hairline and the temporal area that is still visibly thin in the December photo. But he claims that in January, it started to thicken up a bit after switching over to the brand name Propecia. And honestly, from the photos, I don't really see that much of an improvement. I've also never heard of the brand name Sturcia. But when I actually did some research on this company, it's owned by a legit pharmaceutical company in Thailand that was established in 1982 with $500 million in profits. So I highly doubt that the medication itself was the actual problem. And the fact that he started noticing improvement is also a potential sign that after months of finasteride use, whether through the generic brand or Propecia, He noted some improvement to his hair, which throws his Reflex hyperandrogenicity claim out the door, because if that indeed were the cause while he was still on finasteride, it really shouldn't have been fluctuating his hair growth and also his miniaturization, but rather continue to see a decline over time due to upregulation of androgen receptors. It's not like it's going to get better and then worse and then get better again, especially if his presumed androgen receptors are in a hyperandrogenic state. He then states that his balding spot has grown, increasing in size to around 4 by 4 centimeters, and honestly, it's been killing me. I have zero self-confidence in myself. I feel depressed like shit. I can't talk to girls, and I think I would die by my lonely self. I have thought about some theories to explain what's happening to me. My hairline is genetically prone to testosterone in my scalp in addition to DHT. Since finasteride causes a spike in scalp testosterone, it's causing the hairs in my hairline to die off even though DHT is lowered, but it doesn't really make sense since DHT is more potent than testosterone. The brand name Propecia somehow also doesn't work, and I might have to change to another brand. Highly doubt it, since I'm from Singapore and the healthcare system is pretty good here. Somehow my hair loss is an androgenetic alopecia and something else is causing my hair to fall out. Chances of this are slim since my hair is receding at the hairline and I don't have any diffuse thinning or anything. Although the majority of my hair loss is in my right temple as compared to the left, it could be that my hair is just genetically prone to hair loss and finasteride isn't strong enough to suppress it. Doubt so, because I wasn't losing hair to this extent before I started. My hairline was quite stable for a long time, although I was still seeing increased hair fall. I have thyroid or vitamin deficiencies, not likely since my hair loss is not diffuse but have androgenetic alopecia patterns, and I am on Nutrafol. Anyway, now that I have taken finasteride for almost 1 year, I can be certain that finasteride is definitely wrecking my hair. But the sad thing is that I can't stop because there is a high chance that if I stop, then I would lose my hair even more due to DHT. So I'm literally fucked. If there was ever a chance that I can go back and not take finasteride, I would pay anything to do it. But I guess by sharing this, it helps if there are people in similar situations as I am, or those that are thinking of starting finasteride can reconsider. Moving forward, I think I would gradually lower my dose of finasteride to 0.5 milligram every other day to see if it helps. I've also added stamoxidine to my regimen, and I am starting oral minoxidil. I've also ordered RU-5841, but I'm hesitant to use due to its shady safety profile. Anyway, now I am legit depressed and I hate my life. I don't know how I'm able to continue like this, and it's killing my self-confidence and self-worth. If you are able to help me figure out why and reverse my hair loss, it would literally save my life. So before I dive in, let's go ahead and take a look at some of his more recent photos. This is from March 2022, and we can still see that his miniaturized temple and hairline are still very visibly present. And then in April, seems to have progressed more as we can see the scalp and with more miniaturized hairs. Here are some more current photos, and we can see some miniaturization to the hairline and both temples, with the right side having thinned out a bit more than his left. And a year after his finasteride use, he obviously hasn't seen much improvement. Now, it's true that finasteride increases testosterone levels by about 10% despite lowering DHT levels, but testosterone does still contribute to miniaturization of hair follicles, just to a far lesser extent than DHT, since it is significantly less androgenic. If you have a high enough sensitivity to androgens, then testosterone also is going to cause miniaturization. You will eventually start losing ground again, and that's what appears to be the case for this guy. And this is why, even people who are on dutasteride are still, or can still be non-responders. You have a surplus of testosterone levels that is still androgenic, let alone scalp DHT levels that are dropped by over 50%, and systemic DHT levels that are reduced like 90% plus. Finasteride obviously reduces scalp and systemic DHT levels far less than dutasteride. So, if you guys really want to maximize your hair growth potential, you just really have to target hair loss through various mechanisms of action and through different angles. It's good that this guy is planning on incorporating oral minoxidil, which has shown to stimulate a lot of hair growth in most users. Sometimes the effects from oral minoxidil is strong enough to the point where the growth that you guys are going to see is going to offset the loss from hairs affected by androgens. I would also recommend he look into an anti-androgen. I know he talked about RU-5841. Another good choice would be pyrolutamide, especially from recent phase 2 studies from Kintor, showing that its efficacy is on par to that of dutasteride, if not even better. You can also look into CB0301, as these anti-androgens leave endogenous androgen levels intact, but rather compete locally at the androgen receptor. He can also throw in MICRONEEDLING, which helps stimulate growth factors and works well with minoxidil. The good news is that he doesn't have any side effects from medication so far. He has good enough density to the point where he could, obviously get a hair transplant to fix his hairline and temples. And as long as he's able to incorporate an anti-androgen into his hair loss treatment regimen with oral minoxidil, I think he's going to see some pretty favorable results. I would also recommend that he switch from finasteride to maybe 0.5 milligram dutasteride to block more scalp DHT levels. He also mentions about, vitamin deficiencies being a potential cause for his hair loss. But like he mentioned, I highly doubt that that's the case because 99% of hair loss is typically due to androgens. He can always get, blood work done to make sure that there aren't any underlying causes or issues with his thyroid or, from other hormonal imbalances. But like I said, he's in a good position compared to a lot of other folks who are losing hair at a much faster rate. And he's also open to the idea of other treatment options. So I'm positive that this guy will recover from this and hopefully he is going to be able to see more improvement. Anyway, guys, that wraps up this video. Let me know in the comments below what you guys think about this guy's situation. If you've had a similar situation or case where finasteride or dutasteride simply wasn't working, let me know what other hair loss treatments that you guys have incorporated and worked. Thanks again, guys, for all of your support, and I will talk to you guys in my next video. Take care.